Ndaiga Sub-County is nestled between Lake Albert and Rugged Hills. With a population exceeding 20,000 living on over 10 landing sites, the sub-county depends entirely on Ndaiga Health Centre II. The facility was originally designed to serve only one parish. Pregnant women are among the most affected, with maternity services severely lacking.
A pregnant woman cannot be easy for her to climb the mountain or to be put on the border to climb the mountain to go and look for the health center for her to deliver.
The road network in the area is almost non-existent. What are supposed to be roads are mere paths. At Ndaiga, Songolawo and Chitebere landing sites, it is common for pregnant mothers to abandon the idea of seeking professional health care, opting instead to deliver their babies with the help of traditional birth attendants.
They will give you just a Panadol or just a magnesium. So even the woman can say, instead of going to Ndaiga, why don't I go to Congo? Why don't I go to Toroko?
Margaret Munguriek, a mother of 4, lives on Songolawo landing site. All her children were delivered by a traditional birth attendant. During her 3rd pregnancy, she attempted to deliver at the health center, but her baby died due to delays in receiving medical attention. Now 5 months pregnant, she plans to deliver with a traditional birth attendant again.
We travel up a hill to the health center to get antenatal. But when in labor, I cannot go up the hill. I'll give birth here.
Esau Isingoma Opio, a member of the village health team, highlights the dangers of relying on traditional birth attendants.
If she gets pregnancy and deliver to a TBA, she's immediately have to get what? HIV infection to the younger baby. TBA is not a trained person like someone who is like a midwife.
At Chitebere landing site, we meet Pia Ayarango, a mother of 2. She has consistently delivered with traditional birth attendants.
Last year my child died during delivery at the TBA. During the pregnancy, my womb contracted and I was already sick.
But now in the last trimester, Pia explains that her traditional birth attendant gives her herbal medicine and advised her to visit every after 3 days for alignment of her pregnancy because her baby is not positioned properly.
Now I feel sharp pains in my waist and stomach. If I am to go to a health facility, it may be in Toroko.
Abdul Karim, the chairperson of Songolawo village, recalls how the district previously provided a boat to transport pregnant women for antenatal care every Thursday. Unfortunately, the service ended when the boat broke down.
It is difficult to take women in a good number and then you go and spend the whole day there with the hunger and struggling, getting no service to them. Even we became ashamed also as the leaders.
Traveling by boda costs at least 50,000 shillings, an expense that many cannot afford. The situation compelled us to support 2 women by covering their boda cost. At one point during the journey, the motorcycle failed to move any further due to the terrible state of the road, forcing us to proceed on foot. We eventually reached a muddy and slippery stretch, which made the journey even more challenging. Finally, we arrived at Ndaiga Health Centre II, where the women were supposed to receive antenatal services. Unfortunately, they could not get any assistance because the midwife was absent. She had gone to attend a burial 4 days ago.
The workers there, they are not enough. We found only 2 people who cannot afford the whole work for the pregnant women.
Women in labor are often referred to Ndaiga District. Those who can afford to transport their wives to the Democratic Republic of Congo for better health services. Aisha Justin Tumwebaze, a health educator in Kagadi District, acknowledges the challenges faced by women in Ndaiga.
There are no staff quarters in Ndaiga. The situation there is hard to stay. So sometimes we deploy their men and the men cannot deliver these mothers because they are male nurses and 1 health assistant.
Ndaiga Health Centre II is one of the facilities we just have submitted as government that should be upgraded come financial year 2025-2026. We shall ensure that they are staffing, we shall ensure that they are drugs. I believe people at the lake will get the best services.
Kagadi District faces significant health challenges, with its 32 sub-counties inadequately served. Some of them lack health facilities altogether, while those which have existing ones are under-resourced.